Hello, my name is Nisha Rajendran. I'm excited to present my project to you all. My final product was a research paper that evaluates the effectiveness of different home-based ECG technologies in diagnosing atrial fibrillation. So what is atrial fibrillation? It's an irregular heart rhythm that can form blood clots in the heart and disrupt necessary blood flow throughout the body. In a non-AF individual, a healthy heart pumps blood in a regular rhythm, with each chamber contracting and relaxing in sequence. However, in someone with AF, the heart's electrical system malfunctions and causes the upper chambers to beat out of sync with the rest of the heart. The atria tighten and release in random patterns, causing an irregular pulse. This results in a fast and irregular heartbeat, leading to symptoms such as chest pain, shortness of breath, dizziness, and nausea. This is a diagram of a healthy heart versus the heart of a patient with AF. The ECG recordings are being compared as well. Looking at the ECG recordings, we can see that in the normal heart, the pulse is regular, while in the AF heart, the pulse has an irregular pattern. The abnormal electrical pathways are causing this difference. Now, I will discuss the prevalence of AF. It's the most common cardiac arrhythmia, with 8.8% of Americans over the age of 80 being affected by the disease. Because the aging population is growing, AF prevalence is experiencing an upward trend in recent years. The lifetime risk of developing AF in people over 40 is 1 in 4. Some symptoms of AF include chest pain, palpitations, tachycardia, dyspnea, nausea, and dizziness. Now, I will briefly describe the process of AF diagnosis in the hospital. We can compare this to the process of AF diagnosis using home-based technology at home. So, AF is usually diagnosed using ECG tests, which record the electrical activity and heart rhythm. These ECG tests use electrodes that are attached to the patient's legs, arms, and chest. These electrodes are connected to an ECG machine, which produces electrical signals when the patient's heart beats. The ECG machines show the electrical signals on a rhythm strip. The presence of a P wave on the rhythm strip confirms that a patient has AF. Now that I've shared some background information on the mechanics, prevalence, symptoms, and hospital diagnosis process for atrial fibrillation, let's now dive into the home-based technologies I compared in my review paper. First, I'll define what home-based means. Home-based AF diagnosis technologies make it easier for patients to monitor and diagnose their AF condition from their homes. The main aim of these technologies is to improve the accuracy, access, and ease of AF diagnosis for patients. The first home-based ECG technology I'll be talking about is smartphone-based PPG technology. These technologies use PPG technology to take pictures of the patient's fingertip. Then these fingertip pictures go through computer algorithms to analyze the heart rate and pulse rhythm. I looked at two different types of PPG technology, the FibriCheck algorithm and the Pulse smartphone application. In a study regarding the FibriCheck algorithm, the results showed that it had a high sensitivity and specificity, meaning that the algorithm was highly accurate in detecting AF and also had a high accuracy rate in detecting AF when it was not present. In a study done to assess the Pulse Smart app, results showed that the longer 7-day home monitoring had a higher percentage of people diagnosed in comparison to only a single heart rate assessment in a hospital. In my review paper, I also discussed the feasibility and ease of use for these various technologies. The PPG phone apps are simple for users to use with intuitive user interfaces and large buttons. Here is a screenshot of an app using PPG technology. I also looked at a study where PPG technology was combined with a mobile health approach. In this study, the patients used a wristband that collected pulse data using PPG technology combined with a digital AF management program. The patients determined by the PPG algorithm to have possible AF were later confirmed through the mobile AF app, ECGs, and hospitals. So, through the study, I learned that PPG technology, while it's accurate on its own, can also be combined with other digital diagnosis methods for even more accurate diagnoses. Another example of a home-based ECG device is a LifeCore. It's a small portable device that can be attached to the back of a phone. In a study testing out this technology, AF detection rates varied from 0.8% to 36%. This variation is because the study was conducted on a population of people of all different ages. The LifeCore technology is a convenient and feasible home-based technology for monitoring AF. Now I'll discuss wearable devices. I will talk about wearables that are not smartwatch devices first. Firstly, I evaluated the self-applied patch, which can attach to the chest to monitor heart rate and rhythm and record ECG signals from the heart. Patients wearing the patch can give doctors real-time information about their heart's activity, even from home. Results from a study conducted with this technology shows that for high-risk individuals, monitoring with the patch resulted in a higher rate of AF diagnosis after 4 months. This graphic compares the process of home application of the patch to the process of applying the patch at the clinic. It illustrates the steps involved in delivering and returning a home-based ECG patch to the patient and the doctor. Another non-watch wearable is the single lead heart rate belt. In a study regarding this technology, the heart rate belt resulted in a high-quality ECG recording with 100% accuracy of AF detection. Our last home-based ECG technology I will compare are the smartwatch devices. I compared a smartwatch app for AF diagnosis and a watch called Amazfit. In a study conducted to assess the Amazfit watch, it was found that the device has the potential to help diagnose arrhythmia even better than the usual 12-lead ECG machine used in hospitals for diagnosis. In a study conducted with the smartwatch app, not many people got a notification about their regular pulse, but out of those who did, 34% had AF according to the ECG patch. And 84% of the notifications were correct and showed that the patient had AF. So in conclusion, after comparing the accuracy and feasibilities of all these devices, I decided that the smartphone-based PPG technologies have the best balance of accuracy and feasibility, while the heart rate belt is most accurate. These are my resources that I used. Thank you for tuning into my presentation.
Great job, Nisha. All right, so we will go to some questions. Jen's question in the Q&A here is, would you recommend different home-based equipment for patients of different ages? I think that's probably based on that statistic you had shown, where there's some variability.
Yeah, so the typical patient population of AF is elderly individuals. As I said, that 8.8% of individuals over the age of 80 in America are affected with atrial fibrillation. So when choosing the correct AF diagnosis technology, it's important to consider different variables for that age group, such as like ease of use is a big one. Like no matter, even if the technology is very accurate, if elderly population is not able to use it properly, then there's no use. So big buttons, simple user interface, those are the most important variables to consider.
Makes a lot of sense. Mm-hmm. How commonly used are these and like prescribed by doctors? Are they super common for monitoring and diagnosing? And kind of what's the biggest, most popular one used right now?
Well, at the start of the pandemic, when it was unsafe for individuals to visit hospitals due to risk of the virus, basically that's when these home-based ECG diagnosis technologies became really popular. And I'd say like a common one used, which doesn't require like diagnosis or like recommendation from a doctor at a hospital, is probably the Apple Watch app for ECG. But sometimes like doctors, like for some of these apps, individuals can contact the doctors and send the results, like the ECG results, to their doctors. So sometimes depending on how often you'll be visiting the hospital, then you'll decide if you want like a technology where it's easy for you to communicate with your doctor, or one where it's more like you're individually monitoring like on your own.